Hi everyone, my name is Ann Dalen and I'm a person living with diabetes. I'm also a kidney transplant recipient. Thank you for watching this edition of the National Kidney Foundation Diabetes Sisters and Women Hearts Facebook Live series. Today is the second of a three-part series on the subject of diabetes, cardiovascular disease, and kidney disease, and today we're going to focus on how these important health issues affect families. As always, we're really lucky to be joined by three experts. Sitting with me today is Dr. Stacy Rosen, who is a cardiologist or a heart doctor, Dr. Rafia Chaudhry, who is a nephrologist or a kidney doctor, and Amy Hess-Fischel, a dietitian who specializes in the area of diabetes. Thank you all for being here.
Such a pleasure.
Let's get to the reason that we're all here today. I'm going to jump into the first question, and this one is for you, Dr. Rosen. How do diabetes, heart disease, kidney disease share a common thread?
It's a great question. I generally think of those as three overlapping conditions, each of which can have an important impact on the health and wellness of an individual. High blood pressure is a risk factor for kidney disease, a risk factor for heart disease. Those with heart disease have other issues that may cause kidney disease. The good news is that so many of these conditions can be diagnosed, treated together, and that there are so many opportunities to really keep a healthy and long life and not have these end up with significant complications.
Thank you.
Yeah, absolutely. I agree 100% with Dr. Rosen that all three of these conditions go hand in hand and are not isolated and cannot and should not be treated independently. What's really important to recognize is that while diabetes and high blood pressure both are significant risk factors for both heart disease and kidney disease, but kidney disease itself can independently be a risk factor for heart disease. And so it's really, they are very closely interrelated, and it's really key to have your nephrologists, cardiologists, and dietitians all on the same page and discuss it with them.
From what I understand, that sometimes one comes before the other, but it's a sign that you might have the other. Can you address that?
Yeah, absolutely. And some of these conditions can be silent. High blood pressure is generally called the silent killer because it is less likely to cause symptoms until complications potentially of kidney disease. The same may be said with some forms of diabetes, that these really have to be evaluated. Patients need to advocate for themselves and ask their clinicians questions about their risk factors for all the conditions.
Absolutely. And we know specifically in diabetes, when we think of how that's going to affect everything else, they have very simple tools that they can find, are they at risk for diabetes, to try and stay on top of it so they actually will be diagnosed before things will actually happen.
Yes, and like you said, it's silent. You may feel really well, but until you go to your doctor and find out what your blood tests say, you may not be aware of any of these things. So working with your doctor and your team is super important.
And not being afraid of these conditions.
Exactly.
I think there's this fear that if I don't know that I have high blood pressure, or I don't know that my sugar is abnormal, that nothing bad will happen. Right. And the truth is our preventive strategies are so critical to be proactive, to get the help, to get the diagnoses early on.
Right, and don't wait. Ask. Again, certainly healthcare providers are going to do the best they can, but depending on if you're able to see someone, again, it's just so much better to advocate for your own care and say, you know what, I just need to know. Because again, there's a lot of factors that are involved, and we can jump on it quicker.
Exactly. Let's move on to the next question. What is the role of race, ethnicity, and the risk of diabetes for heart disease and kidney disease? Who would like to?
I think we find that especially conditions like hypertension or diabetes, there is a certain genetic predisposition to it, or ethnicity plays a role into that. And so in different races we see a different incident or a different number of patients who are affected, and then also how severe it can be. And so it's really key, again, to recognize that and work closely with your provider and know where your status is with kidney disease and with cardiovascular disease or with high blood pressure. Moving aside from diabetes and high blood pressure, they can also be autoimmune conditions or another small minority of things that might be more common in some races than others. So I think it certainly plays a role in that.
And definitely healthcare providers are always asking the question, does your family history involve XYZ? Because all of those things that we know that diabetes is going to be a family affair, and then all of these other things that are going to lead from that. So it is important to know our family history and again be proactive. So we know that a higher risk for ethnicities, and we want to try and stay on that much sooner. And we also know that certain ethnicities may have different criteria that they have to go by. So again, knowing all of those things and talking to the healthcare provider about that as well.
And also dietary, different backgrounds and ethnicities have diets that are very high in carbohydrates quite often. I went to a lecture by a dietitian, and she focused on the Southeast Asian community. Mm-hmm. And the room was filled with people that were there to learn how to make changes so they could improve their health. It was fascinating.
No, absolutely.
When a clinician asks your race and ethnicity, know that that's not an intrusive question. In hypertension, we know that there are different medications that work differently and work better in different races and ethnicities. So knowing all of that is key.
And certainly lifestyle changes. When we are making recommendations, they have to be individualized.
Yes.
And so again, knowing all of these things and knowing kind of deep cultural differences are going to be really, really helpful to give practicable, actionable recommendations that are going to be met.
Well, continuing with that, as a dietitian and a diabetes educator, what is your role with people with diabetes, with kidney disease? How does your side work into helping them?
Well, I hope that when people do see a dietitian and diabetes educator, they don't look at it as an unfavorable thing. Mm-hmm. The whole point is, we're not food police. Again, it is about individualizing care. Now, we also know that as a dietitian, those within the Medicare population, it's a covered benefit to actually see a dietitian 2 hours every year. So again, it's really important that people understand that. But also with diabetes education, we came out with a paper a couple years ago looking at the critical time points of when people need to be seen for education at diagnosis annually, complicating factors, as well as transitions. So again, people do need to understand that diabetes education isn't a one and done. Nutrition education isn't a one and done. It should be an ongoing process because it should be a dialogue, making small changes that can actually work for that person, but they need to be individualized. So my job is sometimes considered hard, but I think of it as easy because I get to know people and say, this is what we need to do to help you. And if it doesn't work, we go back to the drawing board. And that's really important.
And you're able to give people information that quite often they have no idea of how their food may affect their health.
Absolutely.
It's something they've eaten forever, but when they make those changes, they can change numbers to go from high and dangerous down to a normal, which will help you avoid heart disease, avoid a kidney transplant, avoid things that don't always have to happen.
No, absolutely. And these lovely ladies do a fabulous job integrating, lifestyle change and recommendations because it is, a team effort. Again, while I have a lot more time to spend with patients, but again, we know that this is an ongoing process, that every single healthcare provider is really working with that person to kind of help to identify what changes are going to be best for them.
And to depend on your team.
I think that's so important that these conditions are so multifactorial. How you sleep, how you live, what you eat, the medications impacting on each other, and it can be really challenging. And the idea of clinicians in different specialties working together is really key to minimize complications for these diseases. And we're privileged when we have the opportunity to work as a team between kidney diseases, heart disease, nutrition, behavioral health, even our exercise physiologists sometimes for our older folks who are challenged to do safe activity.
I'm glad to hear you say all that because that's been super important for me.
I think Amy highlighted a really important point about transitions. So patients with chronic kidney disease, when the kidney disease, the stages are progressing, the dietary needs certainly change. And one thing to recognize is a lot of patients, their insulin requirement changes, because as you have worsening kidney function, the insulin and the medications may hang around longer in your body. And so it's really crucial to talk to your dietitian and know what dietary changes are important for you to incorporate, just for not only for the diabetes but also for the kidney disease aspect. And so transition points is another key area when really you should be conversing with your dietitian, with your doctors.
And another transition is pregnancy.
Yeah.
And that's my next question. Thank you. And how can diabetes, kidney disease, and high blood pressure impact pregnancy? Because a lot of people need to know about this.
So it's sort of interesting. We think of some of the conditions that can occur during pregnancy, gestational diabetes, hypertension related to pregnancy, and historically we thought of those as one and done. Women would deliver their child, their sugars would return to normal, their blood pressures quite likely return to normal, and they thought that they were finished. And we now know that those conditions, actually in the cardiac world, we call them a failed stress test. We really know that women who have either hypertension during pregnancy, diabetes, gestational diabetes, do incur a lifelong risk of these returning and developing cardiovascular diseases. So we know that that's an opportunity for us to really begin lifelong lifestyle choices and changes that can improve their health.
Well, I'd like to go a little further with that and ask, how can having kidney disease affect the chances of having children or complicating the pregnancy?
I think that's an excellent question. So having kidney disease, I think, definitely increases the risk of complications within the pregnancy. And it's really important to discuss that up front and have a planned pregnancy rather than a spontaneous pregnancy. So if you're a patient with kidney disease, it's really important to have that conversation with your doctor and have a planned pregnancy for a number of reasons. The first one, and the most important one that I talk to my patients about, is some of the blood pressure medications and medications that we use that are helpful for diabetic patients and kidney disease, and in general for patients with cardiac disease. They're called angiotensin converting enzymes, or angiotensin receptor blockers. Those can be dangerous for the baby. So if you were to conceive or have a pregnancy while being on those medications, that would not be good. And so it's really important to have that conversation with your doctor. The second thing is patients who have some autoimmune condition might again be on medications that could be dangerous for the baby, and to make sure that you're transitioning to safer medications before planning to conceive. And most importantly is to be with a nephrologist or a kidney doctor who's experienced in taking care of patients with kidney disease and planning pregnancy. And so it would depend on the level of kidney disease that you have as well, because kidney disease in more advanced stages can decrease fertility for women of childbearing age. And so sometimes some doctors may not be as comfortable and might be discouraging, but it's really important to go to somebody who's had experience in this area.
Thank you. Any other questions or answers regarding this that you found?
Well, I just think adding to that with the education component, because it is just an ongoing, process, to really, you want to get people up to speed well before they get pregnant, and know that there's going to be changes. And depending on if we're talking about kidney disease and diabetes, again, then we're going to be looking at multiple changes in medications throughout the entire pregnancy. And then once delivery, and then also kind of having some ongoing support after as well.
Thank you. Now we're going to move on to one that's extremely important, and anybody that has any of these health issues needs to be super aware of, and those are lifestyle changes. So can that improve kidney function? Can it improve the other health issues such as cardiovascular and all the other things that go with this?
So the good news is that the vast majority of each of our risks for heart disease is modifiable by lifestyle choices. And my second favorite piece of information is that it's not all or none. You don't have to always eat well. You don't have to exercise an hour a day and run the New York City Marathon. We have found that small changes, consistent over a lifetime, will have an enormous impact. And this is where, again, that whole team approach comes into. I dare to say that clinicians are not as well trained as our dietitian colleagues, and that working together as a team, particularly when it comes to certain races and ethnicities, it's difficult to give up family meals that have been, part of your custom. But all of the small things that we do have an enormous impact on diabetes management, on kidney disease, and on heart disease. I think it's a good thing as opposed to something that challenges people.
Well, absolutely. And I think that we just have to we have to change the messaging that we're giving to people, because that whole all or nothing approach has really been tired out. We have to look at small, even one goal. If we can just look at one small goal, again, it is a marathon, not a sprint, even though no one is going to be, I'm not asking anyone to do a marathon, but, again, we do have to look at, tiny changes are going to have the big impact. But again, we can't have people get discouraged that this is going to take time. Yes. We're in this society that we want things done now, and we have to understand that we have to make small, tiny changes that are going to have a huge impact on our heart, our kidney, on diabetes, self-management for the long term.
And in this day and age, there is no reason why we shouldn't be able to get diabetes under good control or high blood pressure under good control, diagnosed at an appropriate age, or stage, I should say, rather, because we have the medications, we have all the great medications, but as equally important is lifestyle changes, and they kind of go hand in hand. So if your doctor is giving you all the high blood pressure medications or all the diabetic medications in the world, but we're not implementing the lifestyle changes, not cutting back on sodium, not doing the right things in terms of diet, even in small ways, working towards that, it's going to be very hard to control those risk factors and not run into the kidney complications and the cardiovascular complications. So I think lifestyle is as important, if not more in some ways, than medications themselves too.
Thank you. Speaking for myself, all of this is 100% true. From where my numbers were a while ago to where they are now, one of my doctors looked at my results and said, are these the right tests? Because my A1C, which was not unbelievably high, but went down to 5.2, that meant that my medications were not cut in half. They were, I was down to a third of what I was taking before. And that's like a reward. It's really positive reinforcement to see that when you make an effort, changes can happen, and those changes mean that your life can be lengthened.
Absolutely.
So it all goes together in a super positive way.
Awesome
as I spoke before, with these overlapping conditions can worsen each other. The beauty is that improving in one of the categories often has a positive impact on the others. Hypertension, diabetes to chronic kidney disease all improve with the right changes.
Yeah. And the lifestyle recommendations tend to be very similar amongst all of them.
They're all connected.
Yes,
absolutely.
exactly.
And not only does it cut back on medication burden, but also decreases side effects of some of the medications that you may be experiencing. So I think that's great. Excellent.
Can you give me a couple of specifics that you speak about with patients regarding their lifestyle change, something that you would put at the top of your list that you'd like to see them do?
I think when you spoke a little bit about the importance of flipping it from not being the food police, I actually speak to people. It takes a month to 6 weeks to have a habit become sort of firmly. So we kind of discuss in the different arenas, where do they think they can have an easy win? Is it walking 15 minutes a day? Is it giving up the bread basket? And then together we decide on one win, and we're going to focus on one win for the next 6 weeks, 8 weeks. And then that positivity kind of then leads to the feeling that, oh, this isn't impossible. We don't use the word diet, we use food choices.
Perfect.
We don't say exercise, we say physical activity in our practice. It's silly, but you want to be proud of the things you can do rather than being discouraged about, what you fail at.
No,
I think one thing that I really speak about with my patients is processed foods, especially from a kidney perspective. Patients who have more advanced kidney disease. Their phosphorus levels can also be difficult to control, along with the diabetes and along with many other things, sodium that we're trying to cut back on for high blood pressure. And most of these processed foods will make many of these conditions difficult to manage. And so we talk about, TV dinners and processed foods and trying to cut back on those, trying to make healthier food choices when you go out to eat. Again, it's all about balance, not stopping that completely, but trying to educate about why it's important to know the ingredients that go into your food. So cutting back on processed food, definitely one.
My big one is regular soft drinks. Again, if someone can do one thing, again, eliminating just caloric beverages could have such a big impact on calories, on blood sugars. I'd say, it's amazing. So it just really, again, I like to echo, it's just really focusing on that one thorn in their side that we can really kind of work on to make a successful behavioral change.
And I think being proactive as a patient, we have to do what's best for ourselves, use the resources around us, take advantage of whatever our healthcare providers are talking about, or support groups like Diabetes Sisters, Women Heart. All of these things will help us in the long run. They really will. And I wouldn't be sitting here if I didn't have all this help. And plus Facebook. People don't always like Facebook. I love Facebook because I'm in groups that are so supportive and so helpful, and it makes a huge difference. And once you get this positive reinforcement, it helps you to make the changes that you're speaking about.
And no man is an island. And so I think you bring a very good point that, again, having some support and ongoing support is crucial for any kind of treatments that people are doing, because again, we need to have that positive reinforcement from a lot of sides to kind of build us up.
Including from ourselves.
Yes.
Pat yourself on the back if you've accomplished something.
Absolutely.
Well, this has been a great discussion, and now let's take a minute to see what some of the viewers on Facebook are asking. I'll remind you that if you have any questions on this subject, please post them in the comments section, and we'll do our best to answer as many as we can. And I want to thank everybody, because this has been very helpful for me, which means it has been for everybody that's watching. Now, please know that if we run out of time, all your questions will be answered on the National Kidney Foundation's Facebook page in the coming days. Okay, so here's our first question. How can people find emotional support and help managing their health?
I think it's so crucial that when you're going in to see a doctor, that you take family member with you. Just in that instance, it's so important to have that morale boost, that emotional support, but also it's so important to have somebody with you, because it's very difficult to retain all the information that's thrown and within a doctor's visit as a patient, thrown at the patient. And it's because doctors are trying to educate patients on multiple things, whether it's medications, side effects, lifestyle changes, so that 20-minute visit can become very compact. So I think one way of doing it would be to take in family members or somebody with you to the doctor's visit.
An organization like Women Heart has support groups throughout the country. These are women who are either those who have heart disease or those at risk, which are so many of our patients, and they are trained formally, and then they have monthly support groups that are open, free of charge, and you start realizing that there are other men and women like you, and then this marathon becomes something that you share with people.
Now, I attend Diabetes Sisters.
Don't forget about Diabetes Sisters.
I never forget about them. They're a true lifesaver for me. I'm a co-leader of a group in central New Jersey, and my co-leader and I use this as a tool to help ourselves, and we know that we're helping other people. And again, it's a free support group. People get together throughout the country, and it's a great resource, and that makes a huge difference in how somebody's health can go forward and
Right.
they can get healthier.
Finding peer support is
Yes.
crucial. You know, again, as a diabetes educator, yes, I would love to see all people with diabetes or have them see a diabetes educator, but I know that's not possible. So again, having this type of peer support is essential. Again, because you are speaking to a peer that's going through the same things or may have already gone through the same things. So really reaching out to these organizations for all the people that are listening, I think is just essential as an additional piece to their diabetes self-management.
They have great websites.
Oh,
right, for
absolutely.
those where there
Yes.
aren't groups.
Yes, they
and
do.
we know the data's good, and these are the
Yes.
websites to go to for questions about medication,
Right.
about eat this, not that, and wonderful resources.
And we post stories about people who have been successful, who have overcome certain issues, talk about how they're trying to overcome certain issues.
Right.
So all these things are available on these websites, and it's right there for the taking. And actually doctors are referring patients to diabetes sisters, and I'm sure it's the same with Women Heart.
Absolutely.
It really just proves that you're not alone. And that's
Exactly.
so important when it comes to whether we're talking about heart disease, kidney disease, diabetes. You know, again, you're not alone. And again, these are such wonderful things to have available.
We have another question, and this one asks, what is some advice for caregivers with younger or older people in need of their care?
I think, you know, I mean, certainly working with both younger and older individuals, you know, again, I have their caregivers come in, you know, and definitely having that extra set of ears, but I like them videoing or actually, you know, taping the session. So then they have a record of what we talked about. Hopefully I don't swear during the session, but, you know, again, certainly, you know, again, it's just good that they have another source. So there's a lot of different ways that they can, you know, just make sure that they're getting the information.
And as prescribers, I mean, how do you deal with this type of information?
You know, I think some of the importance, as Dr. Chatterjee said, is coming prepared for your visit. You know, we joke that you'd never go to an accountant without all your paperwork together, writing questions ahead of time, bringing a family member, as you suggested, because these medications are complicated. The lifestyle changes can be difficult to understand. Being an advocate for yourself and your family member, I think, is really important. There are people who think of diabetes, kidney disease as being family conditions.
Yeah.
And both in the positive opportunity to kind of, you know, get together and make good choices.
Together, yeah, absolutely.
And that's important. After my transplant, I was in no condition to listen to what they were talking
Right.
about. I needed a family member there to help me understand what did I need to take 3 of 4 times a day, what did I need to take 2 of every other day. And
don't be afraid to ask, to have the clinician repeat it over and over.
And write it
to
down.
tape or write it down.
Writing down, you know, again, patient instructions. There's lots of electronic medical records that
Yes.
there's always places for that. But, you know, again, as we've been kind of talking before, it's about advocating for your care and make sure that you are asking the questions. Bring a list of questions that you want to talk about. And again, make sure that they're writing everything down for you too.
well, this goes into another question. Oh, I'm sorry. Did you
Oh, I
want-
was just going to say the crucial role of having a medical diary, as Dr. Rosen alluded to. And then another trick that I really like for caregivers for older, younger patients is using pill boxes to lay out medications.
Yeah.
Because a lot of older patients, you know, have confided in or shared that sometimes it's reading the medications, you know, getting those mixed up and might take a double dose, which can be very dangerous. And so using those tricks, I think caregivers can really support family members in very easy ways.
Well, this next question is in the same vein, but a little bit different. How can people get help with understanding their medications? Not just how to take them, but understanding the medications that they're being prescribed.
Well, I guess it starts by always keeping a good list of what you're taking. If there's any confusion, I tell patients, bring your brown bag, put everything in it, and being sure that we eliminate drugs that had been stopped. But it also expands our medical team to include the pharmacist.
Exactly.
Whether it's in our inpatient or outpatient units or in your local pharmacist, they are professionals who really can have, you know, a really important role in managing medication challenges.
Yeah, and don't feel like you can't go to the local pharmacist and plunk down the bag. I mean, hopefully you're getting all of your medications from the same place, but sometimes people don't because of cost. And so again, having a little consultation with that pharmacist and say, help me, and again, that expert's going to be able to fill in the gaps.
Thank you. These have all been excellent questions and answers, and it looks like we've run short on time. So I really hope this was helpful for all of you, and I remind you again, in case we didn't get around to answering your question here, please check on the National Kidney Foundation Facebook page, where we will be posting the answers. You can always contact the National Kidney Foundation helpline. That's toll-free at 855-NKF-CARES. At this time, I'd like to thank our sponsors in being so supportive in helping to make this program possible. I'd especially like to thank our guests, Dr. Rosen, Dr. Chaudhry, and Amy Fischel, for being here with us, and I thank you for helping me walk through this subject. And now, on behalf of the National Kidney Foundation, Women, Heart, and Diabetes Sisters, I'd like to wish you all good health. Thank you.
Thank you.
This has
been a pleasure.
And now
It's been great.
Thank you. Yeah, it was great.